Most often people with rotator cuff related symptoms have pain that's fairly well defined. It's mostly actually over the outside portion of their shoulder, in the area where, say, an insignia patch is on the side of someone's shoulder. That's the distribution of where patients complain of pain. It's not deep down inside the shoulder joint where patients often complain of pain, and that's why it can be confusing sometimes to people that they don't relate a rotator cuff to the side of their shoulder, but actually that's the most common area where the pain is localized. Pain with repetitive overhead activities or overhead use, night pain also is very common. So patients come in having problems with sleeping on the affected side or just sleeping in general due to pain in that area. In a more elderly patient, a simple slip and fall can tear a significant portion of the rotator cuff, or say doing very simple repetitive everyday activities in someone that has a already compromised rotator cuff can wind up inciting symptoms in that shoulder. In a younger patient population, in order to have a full thickness rotator cuff tear, you need actually a fairly high energy injury, say a fall from 20 feet or a ski injury that is fairly severe. So if you do have an injury to your rotator cuff, actually it's very important for you to take care of your shoulder and actually be seen by a physician for this specifically. Rotator cuff tendons or tears will not heal themselves in general. So if you have a full thickness rotator cuff tear, therapy can be helpful, but in a significant number of them, surgery may be required for them. So if you do have a rotator cuff tear, seeking a physician for clinical advice, and then also whatever the recommended treatment, either physical therapy or surgery or medications to improve your symptoms, to be diligent in kind of following the prescribed treatment is important, because patients can have long-term issues with their shoulder if they don't go along with the prescribed treatment and are diligent in care for a long-term basis. So in a significant number of rotator cuff problems that I see, I initially treat non-operatively. So physical therapy is a big portion of the initial treatment for patients. Even with patients with full thickness rotator cuff tears, a group of them can be treated very effectively with conservative measures. And the conservative treatment they'll prescribe in terms of therapy is focused basically on two things. One is to strengthen your rotator cuff and the surrounding muscles of your shoulder, including your deltoid and the muscles that insert onto your scapula, and also to keep the shoulder limber, so to keep it flexible. A combination of both things, stretching and strengthening, will be able to allow the other muscles in your shoulder to compensate for the affected rotator cuff muscles to hopefully provide you improved pain relief and function. I'll briefly describe 3 simple stretching exercises that can be done at home and are very effective in the initial treatment for rotator cuff problems. The first is the walking wall stretch, which is basically focused on forward elevation of the arm. Patient goes up to the wall in a house and basically takes their affected arm or extremity and slowly raises the arm up overhead while walking the fingers up the wall. Once they reach a point where the arm is elevated, where they feel a stretch, they then just lean into that a little bit for 5 or 10 seconds and then allow the hand to lower, and they repeat this several times. Number 2 is the cane stretching exercises, which is these are done with the patient lying down, and they take a cane or a stick or some type of broom handle and holding the stick or cane in both hands, what they do is they then rotate the affected shoulder so that they're pushing the cane into the hand of the affected shoulder, which then allows you to stretch this in an external rotating manner. Then the hand is then brought to a neutral position and then repeated 2 or 3 times 2 or 3 sets for, again, 10 or 15 repetitions. The third is towel stretching exercise, where in this exercise we're really looking to work on internal rotation of the shoulder. The affected hand is brought down towards the hip of the patient, and the good arm or the good hand is brought overhead. And then a towel is used, a normal bath towel, and it's grasped between both hands, and just as if the patient's drying off their back, they take the good hand and they raise the arm up overhead, which then winds up raising or internally rotating the affected hand or arm down by the hip of the patient. And then this again is repeated 10 or 15 times for 2 or 3 sets. If your shoulder continues to bother you over a prolonged period of time, say several weeks to months, I would recommend someone actually being seen by a physician that has experience evaluating patients with shoulder problems, because again, there are some problems in the shoulder that if you wait longer, it can become more difficult to treat the problem. So being diligent and understanding that some of these problems need more formalized treatment should prompt people to go to a physician if they wind up having persistent symptoms or complaints localized to their shoulder.